This is All India Radio. Good afternoon. I'm Abhishek Mukhopadhyay and with me is Prashant Kumar Sinha with the Midday News. The headlines. Nation to join Prime Minister Narendra Modi's call to light up diyas candles at 9 p.m. today in a collective spirit to defeat coronavirus. Citizens reminded to maintain social distancing and not to use alcohol-based hand sanitizer while lighting up lamps. Indian Council of Medical Research defines protocol for rapid antibody-based blood test of COVID-19. Defence sector gears up in the national fight against COVID-19 with facilities of isolation bed, hand sanitizers and supply of ventilators. And in Jammu and Kashmir, security forces eliminate 9 terrorists during the last 24 hours in 2 different operations. The nation will today join in the Prime Minister Narendra Modi's call to switch off lights of the homes at 9 p.m. for 9 minutes. They will light up diyas, candles or mobile flashlights to display the nation's collective spirit to defeat coronavirus. In a tweet today, Prime Minister has reminded people of the exercise, saying hashtag 9pm 9 minute. Earlier in a video message on Friday, the Prime Minister said we will experience the superpower of light, clearly illuminating the common purpose we are all fighting for. He said, amidst the darkness spread by the corona pandemic, we must continuously progress towards light and hope. He said this is certainly the time of a lockdown and we most certainly are confined to our own homes, but none of us is alone. Mr. Modi said the collective strength of 130 crore Indians is with each one of us and it is the strength of each one of us.
रात 9 बजे घर की सभी लाइटें बंद करके घर के दरवाजे पर या बालकनी में खड़े रहकर 9 मिनट के लिए मोमबत्ती, दिया, टॉर्च या मोबाइल की फ्लैशलाइट जलाएं और उस समय यदि घर की सभी लाइटें बंद करेंगे, चारों तरफ जब हर व्यक्ति एक एक दिया जलाएगा, तब प्रकाश की उस महाशक्ति का एहसास होगा जिसमें एक ही मकसद से हम सब लड़ रहे हैं, ये उजागर होगा.
The Prime Minister urged the people to maintain social distancing, stay indoors and not form groups while lighting up lamps. He said one must never cross the Lakshman Rekha of social distancing.
इस आयोजन के समय किसी को भी कहीं पर भी इकट्ठा नहीं होना है. रास्तों में, गलियों में या मोहल्लों में नहीं जाना. अपने घर के दरवाजे, बालकनी से ही इसे करना है. सोशल डिस्टेंसिंग की लक्ष्मण रेखा को कभी भी लांघना नहीं है. सोशल डिस्टेंसिंग को किसी भी हालत में तोड़ना नहीं है. कोरोना की चेन तोड़ने का यही रामबाण इलाज है.
Mr. Modi also said the way people paid gratitude to those fighting against COVID-19 on the 22nd of last month has become a model that has been emulated by other countries. He added that Janata curfew and ringing of bells have made people of the country aware of the unity amid this challenging time. Citizens advised not to use alcohol-based sanitizers while lighting diyas and candles as it is inflammable. Ministry of Power has clarified that adequate arrangements and protocols are in place to handle grid stability during lights out event at 9 p.m. today. The clarification came in the wake of the apprehensions that switching off lights during the period may cause instability in the grid and fluctuation in voltage which may harm the electrical appliances. The ministry said these apprehensions are misplaced. The ministry said the Indian electricity grid is robust and stable. The appeal of the Prime Minister is to simply switch off the lights in the homes from 9 p.m. to 9:09 p.m. today, and there is no call to switch off either street lights or appliances like computers, TVs, fans, refrigerators and ACs in the homes. Only lights should be switched off. The Power Ministry said lights in hospitals and all other essential services like public utilities, municipal services, offices, police stations and manufacturing facilities will remain on. The call given by the Prime Minister is just switch off lights in residences. The Minister has advised all local bodies to keep the street lights on for public safety.
The number of confirmed novel coronavirus cases in the country has climbed to 3,374 today, while the death toll rose to 77. Health Ministry data said the number of active COVID-19 cases stood at 3,030 and 266 people were either cured of the disease and discharged, and one had migrated. The Health Ministry reported 2 new fatalities, one each from Karnataka and Tamil Nadu. According to the ministry, Maharashtra has reported the most coronavirus deaths at 24, followed by Gujarat at 10, Telangana at 7, Madhya Pradesh and Delhi at 6 each, and Punjab at 5. The highest number of confirmed cases was reported from Maharashtra at 490, followed by Tamil Nadu at 485 and Delhi at 445. Kerala has 306 positive cases so far, while the number of cases has gone up to 269 in Telangana and 227 in Uttar Pradesh. In Gujarat, people are ready to illuminate their houses with lamps following the call given by the Prime Minister. More from our correspondent.
People of Gujarat will join the nation to fight against the coronavirus following the call of Prime Minister Narendra Modi to light up diyas, candles or mobile flashlight at 9 p.m. People who are strictly following the lockdown at present in the state are also alerting each other to respect the Lakshman Rekha of social distancing while lighting up diyas for 9 minutes. Meanwhile, State Energy Department has appealed to the people not to switch off TV, fridge, AC or fans as the voltage and frequency variation will be handled by the department. It also instructed to the Gram Panchayat, Nagar Palika and municipalities to keep the street lights on to maintain the law and order situation. Power supply to all hospitals and in other emergency services will also remain on. Yogesh Pandya, AR News, Ahmedabad.
Our Bhopal correspondent reports that people in the state are ready to make the Prime Minister's appeal successful.
All socio-cultural organizations and resident welfare societies have made extensive preparations to illuminate their cities. Madhya Pradesh Chief Minister Shivraj Singh Chauhan has also asked citizens to make the Prime Minister's appeal successful.
हमारे प्रधानमंत्री जी ने फिर आह्वान किया है हमें 9 बजे से 9 मिनट तक हम अपने घर में हम दिया जलाएंगे। प्रधानमंत्री जी के इस आह्वान को आप सफल बनाएं।
An elder from Narsinghpur has pleaded to illuminate the entire village by making 1,000 earthen lamps. Vrindavan Prajapati of Gotegaon Tehsil says that following to the message of Prime Minister, he will light these lamps.
तभी हमारे माननीय प्रधानमंत्री जी ने घोषणा की कि हर आदमी को अपने घर में रात्रि 9 बजे दिए जलाना है ताकि इस दिए की रोशनी से कोरोना अंधकार जो फैला है वो नष्ट हो सके।
In the fight against corona, Madhya Pradesh is ready to fulfill the Prime Minister's appeal while following social distancing and within the limitations of lockdown. Sanjeev Sharma, AIR News, Bhopal.
In Arunachal Pradesh, a total of 134 samples of suspected COVID-19 have been collected for laboratory testing till Saturday evening. 25 samples connected to Nizamuddin Markaz, which were sent for laboratory testing, tested negative. Coronavirus cases in Maharashtra have surged to 661, with 26 new cases reported till now. The state government has initiated some more measures to fight coronavirus in the state, with cluster containment plans to conduct survey with the help of health teams. More from our correspondent.
Over 10 lakh people in Maharashtra have been traced with surveys through Cluster Containment Action Plan. 523 health teams are active in Mumbai, 423 teams in Pune, 210 teams in Nagpur, and 196 teams are active in Navi Mumbai to conduct survey under this action plan. Total 2,849 teams are working throughout the state. Health Minister Rajesh Tope informed that the state government will provide online training to about 1.25 lakh Ayush doctors in the state throughout the week to provide necessary trained manpower to prevent coronavirus spread. He also informed that necessary equipment, including about 1.5 thousand ventilators and 2.5 lakh N95 masks, are available so far. Madhuri Pange, AIR News, Mumbai.
Our correspondent reported that exclusive COVID-19 specialty hospitals work has begun in Kasaragod, Kerala.
Kasaragod is the worst hit district in Kerala with over 100 COVID-19 patients. The new administrative block of Kasaragod Medical College is being converted to the exclusive COVID-19 hospital. A team consisting of 26 doctors and medical staff from Thiruvananthapuram Government Medical College has left for Kasaragod to join the effort to create the new hospital. The group will coordinate the operations, train the staff and treat patients. The hospital will have 200 isolation beds and 20 intensive care units. Meanwhile, presently 254 COVID-19 patients are there in Kerala and over 1,71,000 people are under observation. Mayusha for AR News from Thiruvananthapuram.
The Assam government has extended support to the regional news unit of AIR Guwahati to reach out to the maximum number of listeners in the state. More from our correspondent.
The Directorate of Information and Public Relations is broadcasting the COVID-19 fact-check program Pratirod through 6 loudspeakers in Assam. It will help to reach out to the maximum listeners. Apart from that, Regional News Unit and Assam Police held an interactive live quiz and discussion program last night on COVID-19. The idea of holding the quiz program was to engage radio listeners in a positive way. Participating in the program, additional DGP Harmeet Singh appealed people not to spread fake and provocative messages through social media. Mr. Singh has also asked people not to believe in rumors. Apart from that, the AIR Guwahati station is also doing an interactive musical program daily on COVID-19. Manas Pratim Sharma, AIR News, Guwahati.
In Mizoram, the Holy Palm Sunday is being celebrated in a different way. The churches have kept church services and religious events suspended to avoid gathering and to maintain social distancing in the wake of COVID-19. A report from our correspondent.
During the lockdown period, all services and congregation have been put on hold, and sermons through programs like Home Crusades are being held on local TV and is live streamed. Different denominations of churches began their services today at 10 through local TV and are live streamed. The Palm Sundays symbolize Jesus being welcomed into Jerusalem by devotees carrying palms, starting the final Holy Week of his life before his crucifixion on Good Friday and culminating with his resurrection on Easter. The celebration of Palm Sunday during the lockdown, announced by the Prime Minister Narendra Modi, further shows how strictly people of Mizoram are adhering to lockdown guidelines. Irene, AIR News, Aizawl.
Jharkhand registered its third positive case of coronavirus today, taking the total number of cases to 3. The lady from Bokaro had returned from Dhaka with a foreign travel history to Bangladesh and has been tested positive. Our Chennai correspondent reports that this disinfection drive is going on throughout the state of Tamil Nadu.
In the Hosiery town of Tirupur, the district administration installed a disinfection chamber at the entrance to a vegetable market early last week and has got a good response from the public. Before entering the market, people are made to go through the chamber having a sensor that sprinkles vaporized disinfectants once a person is sensed by it. The low-cost device is now installed in 4 places in Tirupur district, and similar gadgets have been erected now in other districts like Tirupattur as well. Such simple innovations help tremendously in the fight against the SARS-CoV-2 virus that causes the pandemic. Jai Singh, AIR News, Chennai.
8 Tablighi Jamaat members from Malaysia were intercepted today by Immigration Department at IGI Airport in the national capital. They were trying to flee by air relief flight from Malaysia by reportedly hiding their participation in the Tablighi Jamaat at Nizamuddin. They have been handed over to the Delhi police. Air India has said that 3 of its passengers who travelled on 3 separate flights have tested positive for COVID-19. The airline informed via Twitter that a passenger from AI661, which flew from Mumbai to Goa on March 19th, has tested positive for COVID-19. Another passenger on AI883, which flew from Mumbai to Goa on the 22nd of March, also tested positive. A third passenger who travelled on AI101, which flew from Mumbai to Delhi on March 20th, and AI415, which flew from Delhi to Patna on the 23rd of March, has tested positive.
Union Health Minister Dr. Harshvardhan has said that more than 50 crore poor and vulnerable citizens will be eligible for free COVID-19 testing and treatment under Ayushman Bharat Pradhan Mantri Jan Arogya Yojana PMJAY. In a tweet, Dr. Vardhan said that testing at private labs and treatment in designated hospitals has now been made free for Ayushman beneficiaries across the country. He said the private sector should act as a key partner in the fight against COVID-19 infection. Dr. Vardhan appealed to the private labs and hospitals to come forward in large numbers to become a part of this effort. Government has urged the people to wear homemade masks to keep coronavirus at bay. In an advisory, the Health Ministry asked people to wear face masks, particularly when they step out of the houses. A report.
The ministry said social distancing and personal hygiene are keys to prevent COVID-19 infections. Certain countries have claimed benefits of homemade face cover for the general public. Such homemade face cover is a good method for maintaining personal hygiene, the advisory said. It said the use of such masks will help in protecting the community at large. Talking to media, Joint Secretary, Ministry of Health and Family Welfare, Love Agarwal said the use of such masks help in protecting the community at large.
कोई भी आदमी अपना जो ये फेस कवर है, प्रोटेक्टिव कवर है, इसको दूसरों से शेयर ना करे. अगर फैमिली में 4 मेंबर हैं और उनको चारों को यूज करना चाहते हैं तो चारों अलग अलग यूज करें. दूसरा हमने कहा है कि आप उसको मल्टीपल में बना के रखें. यानी कि अगर एक आप फेस कवर को धो रहे हैं तो दूसरा फेस कवर आप यूज करें.
In the US, President Donald Trump has asked all his citizens to voluntarily use non-medical masks as an additional public health measure to fight the coronavirus. Saurabh Sinha, News Desk.
The Indian Council of Medical Research, ICMR, has set a fresh protocol for healthcare workers to start with rapid antibody-based blood test for COVID-19. The ICMR has framed a newer strategy for areas reporting large migration gatherings and evacuee centers where number of COVID cases are arising. The top medical research body stated that cases of influenza-like illness, ILI, are to be monitored in health facilities. The advisory also mentioned that as a matter of abundant precaution, all symptomatic ILI persons should be advised home quarantine for 14 days. To ensure that all such cases are monitored and necessary action is initiated, the ICMR has sought details of all test results to its portal and update real-time data. Failure to do so will be held liable to action against the Disaster Management Act 2005. The government has constituted an empowered committee chaired by Niti Aayog CEO Amitabh Kant for coordinating with the private sector, NGOs and international organizations for COVID-19 related response activities. It will address the issues pertaining to identification of problems, effective solutions and formulation of plans with 3 groups of stakeholders. The first group is the UN agencies World Bank and Asian Development Bank. The second is civil society organizations and development partners. And the third group is industry associations, CII, FICCI, ASSOCHAM, NASSCOM. The empowered group had detailed meetings with UN Resident Coordinator for India and country heads of WHO, UNICEF, UNFPA, UNDP, ILO, UN Women, UN Habitat. This is All India Radio. Let's take a look at the headlines once again. Nation to join Prime Minister Narendra Modi's call to light up diyas and candles at 9 p.m. today in a collective spirit to defeat coronavirus. Citizens reminded to maintain social distancing and not to use alcohol-based hand sanitizers while lighting up lamps. The Indian Council of Medical Research defines protocol for rapid antibody-based blood test of COVID-19. Defence sector gears up in the national fight against COVID-19 with facilities of isolation beds, hand sanitizers and supply of ventilators. In Jammu and Kashmir, security forces eliminate 9 terrorists during last 24 hours in 2 different operations. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
गांवों के सरपंचों के लिए कोरोना वायरस कोविड-19 से जुड़ी एक आवश्यक सूचना। दूसरे राज्यों और शहरों से वापस आए लोगों को कोविड-19 के बारे में ये जानकारी अवश्य दें। आपस में 1 मीटर की दूरी बनाए रखें। नाक, मुंह या आंखें अनावश्यक न छुएं। बार बार हाथ साबुन से अच्छी तरह 20 सेकंड तक धोएं। खांसते एवं छींकते समय रुमाल या कोहनी से नाक मुंह ढकें। कोविड-19 से बचाव के लिए आशा कर्मियों से सलाह लें। अधिक जानकारी के लिए अपने जिला मजिस्ट्रेट या मुख्य जिला चिकित्सा अधिकारी से संपर्क करें या भारत सरकार के हेल्पलाइन नंबर 1075 पर कॉल करें।
Defence Public Sector Undertakings, DPSUs and Ordnance Factory Board of Ministry of Defence have pitched in to shore up the national fight against COVID-19.
The Ordnance Factory Board has manufactured and dispatched 50 specialized tents for COVID-19 patients to Government of Arunachal Pradesh at a short notice. Development and production of hand sanitizer as per WHO standards have been undertaken in the factories of the Ordnance Factory Board. They have received a requirement of 30,000 litres from HLL Lifecare Limited, the nodal agency appointed by Government of India for centralized procurement. First lot of 1500 litres of sanitizer was sent on 31st March. Ordnance equipment factories located at Kanpur, Shahjahanpur, Hazratpur in Firozabad and Chennai are engaged in developing cover-all and masks. Defence Public Sector Undertaking Bharat Electronics Limited has stepped in at the request of Ministry of Health and Family Welfare to manufacture and supply 30,000 ventilators for ICUs within the next 2 months. Ordnance Factory Medak has undertaken repair of ventilators in various hospitals. Anupam Mish, AR News, Delhi.
When the country is fighting against COVID-19, innovators like Dr. Deepak Agarwal of AIIMS have developed cost-effective ventilators for the patients. Speaking exclusively to AIR News, Dr. Agarwal, who is Professor of Neurosurgery in AIIMS, New Delhi, said the inspiration to develop the ventilator came from the patients at AIIMS who could not go home until a year just because they were dependent on the ventilator, and the patients who need it lifelong.
This ventilator, although looks small, it is a fully functional ICU ventilator which can be used in any advanced ICU. It can be used as a portable ventilator for transport. It can be used in ambulances. And yes, of course, it can be used at homes for home ventilation.
Dr. Agarwal said he, along with the robotic scientist Divakar Vaish, developed the ventilator 5 years back, and now the capabilities of the ventilator has been improved. The inactivated virus is trapped at the expiratory end by a positive charge system and protects the environment.
Any ventilator which is imported has a huge cost difference. Airplane ventilators cost between 10 to 15 lakhs one piece, and our ventilator starts at 1.5 lakhs. So you can see the difference in cost. Secondly, we have our indigenous design and manufacturing techniques ensure that a ventilator parts can be sourced easily and made in very less time. So that is one of the biggest advantages we have over the competitors.
In a series, Experts Speak on All India Radio News, we bring you the views of the leading medical experts on COVID-19. Dr. M.V. Padma, Head of Neurosciences Center, All India Institute of Medical Sciences, New Delhi, has said that people need to stay home to stay safe and break the chain of transmission of COVID-19.
A virus has invaded our earth. It has invaded us. And there are zillion concerns. There are concerns about our survival, about food, about education, about career, about profession, about our movements. But these are questions for the first time in 3 generations that we are facing. But they're of relevance only if we are alive. To stay alive, stay home.
Dr. Neeraj Nischal, Associate Professor, Medicine in All India Institute of Medical Sciences, Delhi, tells why the lockdown is essential and why is it required to follow the advisories.
This is a new virus, so it has got a very big ego. It will not come to your house unless you go out and invite it. So stay home, stay safe.
For listening to other experts, tune into our next bulletin. Sportsperson Milkha Singh, in an exclusive talk with AIR News, has urged people to stay home to be safe.
भाई मिल्खा सिंह की तरफ से सबको नमस्कार। मैं आप लोगों को ये कहना चाहता हूँ एज ए स्पोर्ट्समैन कि आप मेहरबानी करके घरों के अंदर हैं, रह रहे हैं। आप 15-20 मिनट के लिए एक्सरसाइज आपके लिए बहुत जरूरी चीज है। अब मेरा बेटा है जी मिल्खा सिंह, इंटरनेशनल फेम का गोल्फर है, मैं भी रनर रहा हूँ। तो हम दोनों मिल के अपने घर के अंदर, इवन मेरी बीवी, मेरा पोता, सब जो हैं, हम आधा पौना घंटा निकालते हैं, जंपिंग करते हैं, जॉगिंग करते हैं, पेट की एक्सरसाइज करते हैं, बैक की एक्सरसाइज करते हैं। तो उससे क्या होता है कि ब्लड आपकी बॉडी के अंदर सर्कुलेट करता है और बीमारी जो है आपके नजदीक नहीं आ पाती।
Bollywood actor Nagarjun is also advocating social distancing and safe home staying.
It must have been very tough for Prime Minister Narendra Modi ji to take this extreme decision of lockdown. Let's follow our leaders, let's follow rules, stay home, stay safe, and of course, stay healthy.
Veteran actor Mohanlal appealed people to follow Prime Minister's instructions.
Amidst a nationwide lockdown, our Honorable Prime Minister has requested all of us to join in solidarity today 5th of April at 9 p.m. for 9 minutes in a spirit-lifting initiative to light a lamp in front of our homes. The light that we shine should be the beacon for hope and solidarity for all the Indians, and I implore each one of you tonight to light a lamp in front of your house. My best wishes to this coming together. May this light be our resoluteness. Loka Samasta Sukhino Bhavantu.
The News Services Division of All India Radio in its bilingual live phone-in program will bring you today a special discussion program on COVID-19. Dr. V.K. Paul, member Niti Aayog and chairperson, Empowered Group of Medical Emergency Management Plan to tackle COVID-19 will participate in the discussion. Listeners can ask questions to the experts on toll-free telephone number 1-800-115767. I repeat, 1-800-115767. You can also ask questions on telephone number 011-2331-4444. I repeat, 011-2331-4444 and post queries on a Twitter handle at AIR News Alerts by hashtag AskAIR. This can be heard tonight on FM Gold channel and additional frequencies from 9:10 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on AIR Official. You can also follow us on the News on AIR app for updates.
People across the country are following the government's appeal to stay in their homes during the lockdown period. To deal with the present situation, we spoke to some people on how they are utilizing their time.
My name is Pratishtha and I am from Bihar. I am a senior software engineer and working in IT MNC Capgemini. These days I have also been working from home like others. Apart from doing my office work, whenever I take a break from my job in between, I used to help my sister in kitchen or do some fun activities like reading jokes, having tea and snacks while watching TV. Like I used to think about my good old days, and trust me, this creates a very positive environment in me from outside as well as inside.
This is Prakriti Singh from Bhopal. I'm a student. Currently, I'm completing my online courses and my online assignments. Hopefully, after the 14th, the situation gets better and maybe we can go outside. And
in Jammu and Kashmir, security forces have eliminated 9 terrorists in the Union Territory of Jammu and Kashmir during the last 24 hours in 2 different operations. In an ongoing anti-infiltration operation in the Keran sector of North Kashmir, alert troops braving inclement weather and hostile terrain have so far eliminated 5 terrorists attempting to infiltrate across the LC, taking advantage of bad weather. Yesterday, 4 terrorists were eliminated at Batpura area in Kulgam district of South Kashmir. Jammu and Kashmir Department of Information and Public Relations DIPR launched a website www.diprjkfactcheck.in to counter fake news and misinformation and to generate awareness among the people in the context of COVID-19 pandemic. The department has informed that spreading fake news, misinformation and fear-mongering can land a person in jail as it is a punishable offence, and knowingly or unknowingly forwarding any fake news is a crime. Lieutenant Governor Girish Chandra Murmu yesterday interacted with leaders and heads of various religious groups and organizations of different faiths through video conferencing.
Prime Minister Narendra Modi today paid tributes to freedom fighter and former Deputy Prime Minister Babu Jagjeevan Ram on his 112th birth anniversary. In a tweet, Mr. Modi said freedom fighter Babu Jagjeevan Ram struggled for the rights of the poor and the underprivileged. Prime Minister Narendra Modi has shared a video of former Prime Minister Atal Bihari Vajpayee reciting his poem Aao Phir Se Diya Jalaएं. In the brief clip, Mr. Vajpayee is seen reciting the poem from a stage.
दोपहरी में अधियारा सूरज परछाई से हारा अंतरतम का नेह निचोड़े बुझी हुई बाती सुलगाए आओ फिर से दिया जलाए हम पड़ाव को समझे मंजिल दूर हुआ लक्ष्य हुआ आंखों से ओझल वर्तमान के मोह पाश में आने वाला कल न भुलाए आओ फिर से दिया जलाए आहुति बाकी यज्ञ अधूरा अपनों के विघ्नों ने घेरा अंतिम जय का वज्र बनाने नव दधीची हड्डियां गलाएं आओ फिर से दिया जलाएं.
And now, before we end the bulletin, the headlines once again. Nation to join Prime Minister Narendra Modi's call to light up diyas, candles at 9 p.m. today in a collective spirit to defeat coronavirus. Citizens reminded to maintain social distancing and not to use alcohol-based hand sanitizer while lighting up lamps. Indian Council of Medical Research defines protocol for rapid antibody-based blood test of COVID-19. Defence sector gears up in the national fight against COVID-19 with facilities of isolation bed, hand sanitizers and supply of ventilators. And in Jammu and Kashmir, security forces eliminate 9 terrorists during the last 24 hours in 2 different operations. And for details of these stories and more, log on to our website www.newsonair.com and News on AIR app. And with that, we end the special news program on COVID-19.